There we go. The recording is in progress. So just to quickly introduce myself, I'm Kevin Smith. I lead IUCN work on invasive alien species, but I also work on wildlife health issues, and I'll be talking to you later today. But I'm now going to hand the floor across to a colleague, Billy Koresh, to start the webinar proper. Thank you very much.
Great. Thank you, Kevin. Hello, everyone. I'm William, or Billy Koresh. I have the honor of being one of the co-chairs of the IUCN SSC Wildlife Health Specialists Group, and I'll introduce my other co-chair soon. And also, I'm the chair of the World Organization for Animal Health Working Group on Wildlife. So the two organizations have come together to produce this set of guidelines that we're going to review today. So I'm not going to spend a lot of time talking about them. But this synergy, or this working together between the two organizations, is kind of representative of the approach that we are advocating for, which is a multi-sectoral, kind of a, often called a One Health, but let's just say it's a multi-sectoral approach to looking at and generating approaches to surveillance for diseases and pathogens and toxic agents in wildlife. There are many technical guidelines, textbooks, papers written about how to do surveillance. This is not that kind of basic text for epidemiologists or experts on that. What we really wanted to give is a broad overview in these guidelines about how to think about surveillance, the reasons for it, how to get organized around doing surveillance, who you might want to bring in as a partner. As you can imagine, no one individual or organization has the expertise needed or the legal authority oftentimes for doing surveillance in wildlife. So it really, right from its core, requires kind of this multi-sectoral approach. So we're hoping that these guidelines take some very technical science and translate them into something that's useful and practical for wildlife managers and wildlife disease managers to think about in approaching this issue of how to conduct the surveillance, why to conduct surveillance, what are some of the uses or utilities. So you're going to hear about that today. And I think with that, I'll just move right on to introducing our speakers. With me, I mentioned I had my co-chair is Tiggy Grillo, from the IUCN SSC Wildlife Health Specialist Group, excuse me. And she's also the Chief Operating Officer and the National Coordinator for Wildlife Health Australia. So really great background on that multi-sectoral approach there. Also, you've heard from Kevin Smith. He's the Senior Program Coordinator, and he's the lead for invasive alien species and wildlife health at IUCN. Also joining us and will be presenting to you is Francois Diaz. Francois has a very diverse background. I don't know, we'll have time to hear about all of it, but he's got expertise not only at WOAH for many years, but also in pharmacology and in legal systems as a lawyer. And so he'll be presenting. And then Catherine Machalaba, Dr. Machalaba, also from the Wildlife Health Specialist Group, and she is the principal scientist for health and policy at EcoHealth Alliance. So with that, I hope I'm going quickly. Just as a reminder, we're going to take questions in the chat, and from those, we'll select them, and we'll have a Q&A period close to the end of the session here. And we're going to start with Kevin Smith, turning back to Kevin, who's going to give a quick overview of IUCN work. And then we'll go to Francois, who will do the matching talk on the WOAH work with wildlife. And then we're going to jump into the guidelines. So Kevin, over to you.
Thank you very much, Billy. And yeah, so as many people on this call are probably not members of IUCN or a commission member or secretariat, I just want to kind of spend a few minutes in just presenting IUCN and the work that it does in a very broad sense on One Health issues. So for those of you who don't know, IUCN is a membership union. We were formed in 1948, and we're the largest environmental network in the world. Now, we're actually made up of primarily three parts. We have the Secretariat with over 1,000 staff in over 50 countries around the world, and that's what I work for. I work for the IUCN Secretariat. I'm actually based in Cambridge in the UK. We have our commissions. Now, we have 7 separate commissions, all dealing with different issues. And across those, there are 16,000, more than 16,000 volunteers who basically volunteer their time to be part of these commissions to undertake work in line with the IUCN mission and program. And then we have our members. We have got over 1,400 member organizations. Now, these are state and government agencies, they're subnational governments, national and international NGOs, and also our most recent category, which is Indigenous Peoples Organization. So those three parts, the main 3 parts of IUCN. So like I say, we're a real kind of broad organization. And we have a council, which is the highest governing body. Now, every 4 years, we have what's called our Congress. Now, that is actually our highest governing body. It happens like every 4 years, where members vote on the resolutions for IUCN, they adopt our program, and they vote in our council and commission chairs, etc. So we also have our mandate. So IUCN's mission is to assist societies to conserve nature and ensure that the use of natural resources is equitable and sustainable. Now, we do this primarily through 3 different ways. Through generating knowledge, influencing policy, and demonstrating solutions. In our current decadal program, which is called Nature 2030, it commits IUCN to contributing expertise to advance a One Health policy. And we also commit ourselves to tackling pollution, in particular in marine and freshwater systems. In 2020, at our Congress in Marseille, we also adopted a resolution on One Health, which was really focused around prevention. Now, it calls on IUCN members to promote urgent action on One Health and key international events and processes, for example, the Convention on Biological Diversity. It also calls on our members to take a One Health approach so that wildlife trade does not pose a significant risk, and also to address those drivers that cause significant risk of pathogen spillover. And we're really talking about the prevention element here, which is land use change, agricultural intensification, unsafe wildlife trade and consumption, etc. We also have various different knowledge products and expertise very much that's relevant to a One Health approach. We have the IUCN Red List of Threatened Species, and within that, we have over 160,000 species assessed on the IUCN Red List at the moment, and where we document the threats to those species, including disease. We also have commission expert groups, including, as Billy mentioned earlier, the SSC Wildlife Health Specialist Group. We also have specialist groups both within the Commission of Ecosystem Management and in our protected areas commissions. Our members also have got One Health expertise, EcoHealth Alliance being a key example of that. And IUCN are also represented on a number of different cross-sectoral working groups, for example, with the World Health Organization on an expert working group on biodiversity, climate, and One Health. And WOAH also has representation, with Billy being the chair, of the working group on wildlife. I just want to quickly run through a few of those examples of the guidance documents that are very relevant to One Health approach. So it was a joint IUCN WOAH publication on disease risk analysis. It's all about applying the standards from WOAH, but specifically to the conservation sector. So these are very much targeted to the wildlife health, the wildlife management authorities. The guidelines are for the policymakers. It's a summary publication, whereas the manual kind of really goes into the detail on how to undertake disease risk analysis. We've also recently produced 2 guidelines to support management within protected areas. One of them, which is quite a detailed guidelines on how protected area authorities can undertake prevention, detection, recovery actions. And it's all based around the IUCN Green List standard, for those of you who know it. We also have a separate document that's really targeting the tourism sector to try and identify what strategies the tourism sector can do to make sure that they're taking a One Health approach. On our Panoramas platform, so our Panorama platform is a platform that collates case studies of conservation success, and we've collated those success stories for 21 projects that have applied action targeting wildlife health and zoonotic disease reduction. We've produced what's called a solution publication, which is the results of those projects. We've got lots of other guidance, tools, and projects relevant to that biodiversity health nexus. We have documents on incorporating forests and health within national biodiversity strategies and action plans. We have the global standard for nature-based solutions and how to apply it for human health. We have the global species action plan, which sets out actions that are focusing on species that can meet all the different targets in the global biodiversity framework. And IUCN are also a partner in the Nature for Health initiative, and we have a project in Vietnam running. And we also have a project funded by ICCI, the International Climate Initiative, and we have a project in West Asia on that, focusing again on protected areas and protected and conserved areas. So that's a very brief overview. I'd like to thank you very much for joining us again, and I look forward to the discussions later. Thank you. And I'm handing across now to Francois, who's going to introduce WOAH. Thank you very much.
Yes, thank you, Kevin. So good morning, good afternoon. I'm François Diaz, and I'm going to present you briefly WOAH, the World Organization for Animal Health, and also the activities, the WOAH activities related to wildlife health. And so, yes. So the World Organization for Animal Health was created in 1924. It's an intergovernmental organization, and so this year we celebrate the 100 years anniversary of the organization. The headquarters is in Paris. The organization has 183 members, and the mandate of the organization is to improve animal health, veterinary public health, and animal welfare worldwide. The main mission of the organization are the transparency regarding animal disease. It's the collection, analysis, dissemination of scientific information, and guidelines are part of this scientific information. It's also the safe international trade of animals and products of animals. And link to this, but not limited to this, the World Organization for Animal Health, develop international standards. These international standards are laid down in 4 publications: the Terrestrial and Aquatic Animal Health Code and the Terrestrial and Aquatic Animals Manuals. The World Organization for Animal Health work also on the food safety and the promotion of veterinary services, as well as animal welfare. Regarding wildlife health, the strategy for wildlife health is included in the wildlife health framework. The wildlife health framework was set up in 2021, and it's a kind of a strategic plan for WOAH for the next 5 years. So from 2021 to 2025, 2026. The main outcome of this wildlife health framework are to promote multi-sectoral coordination and collaboration, to strengthen capacity in wildlife health management, to improve reporting and analysis of quality wildlife health data, also to update and develop relevant international standards and guidelines, to disseminate scientific knowledge, and finally, to promote awareness and advocacy to integrate wildlife health issue into veterinary services priorities. The guidelines that are going to be presented today are part of this wildlife health framework. It's mainly in these 3 outcomes. So to promote the international collaboration, and also to disseminate scientific knowledge, and to update and develop international standards and guidelines. So regarding this multi-sectoral collaboration, the collaboration with we develop different collaboration with wildlife international stakeholders, and IUCN is one of these collaboration. And regarding this collaboration with IUCN, MOU was recently updated and agreed by both parties. It will be ratified soon to officialize this collaboration. And so, as I mentioned it, the guidelines that are going to be presented today are part of this work to develop guidelines and to develop and disseminate scientific information. But we have also different guidelines that were developed recently. And so here you can see some of them. It's so a lot of work on the HPI. So for marine mammals, HPI in marine mammals, for protecting wildlife in the face of the current HPI epidemics, and also the consideration for emerging vaccination of wild birds against these disease. We have also guidelines on monkeypox, and very recently guidelines for addressing disease risk in wildlife trade. All these guidelines are available on the WOAH website. And so that's all. Thank you. So now I'm just going to give the floor to Catherine and Tiggy. So just
thank you so much.
I needed to adjust to so yes, to stop to share. So thank you.
Perfect, thank you. And I'll just share my screen. Just give me one moment. But I want to say thank you so much, everyone, for joining us and for your interest in this topic. I think, you know, for those who are already involved in wildlife disease, pathogen and toxic agent surveillance, you know, your work has really paved the way for these updated guidelines. For those who are really new to it, we hope these guidelines will also be very helpful as you get started. And we just really encourage everyone to you know, continue to share experiences. We hope you'll share in the chat the work that you've been doing as well and lessons learned. But just know that these guidelines really take stock of the best practices and the community of practice. So I hope this is the first of many webinars on this topic. So I'm just confirming that you can see my screen and that the slides are advancing. Okay, I'll assume that's a yes.
You're great.
Yes,
You're great,
yes.
Catherine.
Thank you. So we are introducing the general guidelines for surveillance of diseases, pathogens, and toxic agents in free-ranging wildlife. It's a lengthy title, but there's really a lot in these guidelines, and we hope that the different dimensions that are covered in this iteration of the guidelines really brings in the complexity, but also the opportunity of this surveillance that's needed in wildlife and the challenges that are faced by wildlife and the protection of wildlife health and the many One Health benefits. So we will go through what they look like, and then we'll really encourage you to take a look and apply them in your work. So just to go through the table of contents, and you can see here the cover, really, you know, in reinforcing the importance of those who are on the front lines and really interacting with wildlife every day, protecting wildlife, exposed to wildlife, and often the first to witness something that is changing in the environment and in wildlife populations. So the table of contents goes through a lot of different dimensions. We'll look more closely at several of these pieces, but really in terms of what to expect when you receive the guidelines, the introductions, really the strategic context that we're working in, you know, as wildlife health relates to the global biodiversity framework, for example, that was adopted in the end of 2022, and how that affects wildlife and how wildlife really wildlife health contributes to biodiversity conservation. Looking at really also then the operational aspects. What do we mean by surveillance? What are the components of surveillance? And what are the steps to really consider when setting up a surveillance program? And in this case, we're really thinking especially about national level surveillance programs and planning, but of course there may be many opportunities to bring in surveillance through many different contexts and stakeholders. We'll talk about that a bit more too. And then also the financial considerations, how to set up budgets, what to really include in that budgeting to make sure that the necessary resources can really be mobilized and planned for, both in the current term, but also into the future for sustainability of programs. And then other considerations, and I think that this is something, and other resources too to consult, I think this is something that we see as really important, and there are some additions to the guidelines since the previous version, especially around ethical considerations, legal considerations, animal welfare, and really relevant stakeholders and rights holders, and how they should really be involved in the design, implementation, and evaluation of surveillance programs. I also want to point us to the annex, because I think there are a lot of really useful resources there, including the benefits of wildlife health programs and surveillance, how it really contributes to conservation, as well as many One Health outcomes, especially when we think about healthy human populations, but also healthy ecosystems and healthy animals, and how wildlife really fit into those different dimensions and outcomes that we're working toward together. The relevant stakeholders, we know that there are many potential stakeholders of relevance when setting up a wildlife health program and implementing it, and then certainly in terms of the use of surveillance program findings. We'll also look at some of the common sample types to detect disease-causing agents and really the interpretation of them. There are some tables that are very helpful, I hope, for implementation. We'll give a few examples of those in this presentation, but there are more in the guidelines. And then also budget planning examples. So really, if you're thinking through how to set up a budget for a program, what are some common ways to structure it? Really learning from existing surveillance programs and seeing, what might make sense, especially if you have to mobilize resources from the Treasury, for example, or from your ministry or from other stakeholders. And now just really about who is the intended user, who are the intended users, and what is the scope of this current document. So I think there are many potential users. They are really especially oriented as the primary user to the National Wildlife Health and Management Authorities, including the WOAH National Focal Points for Wildlife. And I see we have many colleagues online, including those who are really working on the front lines in protected areas, and who are serving in that National Focal Point for Wildlife role. And I think this role is very crucial as we consider the different contributors to One Health in addition to conservation. And I just want to, thank you all for your work, because it's really vital, and we want, to provide guidance that can be helpful in your work. So I hope that this is a useful contribution to the work that you're already doing, and as you continue to develop out programs. And then, additional populations and groups and stakeholders that have a really key role in managing wildlife in protected and conserved areas. So these are right holders such as Indigenous peoples, local communities, private landowners, and then of course, park and reserve managers and all of the staff that really support that effort, rangers, eco guards, and many others, maybe even tourist concession operators who may be coming into contact with wildlife. And then other stakeholders with a meaning role in surveillance, including occupations that come into contact with wildlife. And then also all of those really along the chain of a surveillance program. So there might be laboratories involved. There might be colleagues who are risk assessment experts who then would use the findings from surveillance, and many others that could have a role both in the use of surveillance and also the design and resourcing of it. I mentioned just briefly about the wider scope of the guidelines. There's an existing guidelines from 2015. I think those were about 6 pages in total, and the new guidelines are about 53 pages, I think. So there's really a lot more in this updated version. About 10 years on, I think we've learned quite a bit about the needs and opportunities, and really a key aspect is the integration of toxic agents, and we heard about the importance of pollution. But I just want to call out that I know the Minamata Convention, for example, is considering wildlife health, and really bringing these different objectives together, these different agendas, and the resourcing and the expertise, and how we can really think about a very systematic way of looking at wildlife health and how surveillance can contribute to that. I think there's a lot of opportunities to join up these agendas. Now, just to define surveillance, as Dr. Karish mentioned, if you're an epidemiologist working on surveillance programs every day, you're very familiar with this. I still think it's quite useful to remind ourselves that it's really this very systematic approach, and it really relies on the ongoing collection, collation, and analysis of information related to animal health, and the timely dissemination of information so that action can be taken. I think this point about action is very important. Surveillance should be purposeful. Everyone is very busy with their day-to-day work. There's a lot on everyone's plate, and it really should be purposeful to contribute to the needs, to the protection of wildlife, as well as other possible objectives. Human health surveillance has certain objectives, but wildlife health surveillance, I think there's a lot of certain outcomes that we have to be thinking about, which other sectors may or may not appreciate. So this is also an opportunity to make them aware, and we hope, again, this resource can be useful in your work to make that argument and show others not in the conservation sector why wildlife health and wildlife health surveillance is so important. So the objective and use of surveillance information, there are, of course, many potential objectives and uses. We really invite you in the chat to show some examples of the programs that you're already leading on, and the different purposes and how you're using that information. But I think two really important objectives are to detect immediate or potential threats and impacts, including emerging diseases, in addition to really establishing what the burden is of endemic diseases. And then also really from the conservation side to support species conservation assessments and the development of species action plans, or even habitat protection action plans. And these both certainly have a role for many different applications. So we heard just briefly about the guidelines for wildlife disease risk analysis. Surveillance information can really inform risk analysis. Also community engagement, really having the evidence then to say, wow, we need to take action, or we need to increase awareness so that people in a community can contribute to risk reduction, whether for themselves or for other species. And then really for the red list of threatened species, I know many colleagues who are on the line are already involved in these assessments, and really the importance of considering disease in those and looking at the impacts of disease on wild populations. So we need to be thinking about the detection needs, whether we're thinking about a specific pathogen, a disease, or a toxic agent, and then the intended use of the information. And then this can really guide us in the design of an appropriate system. So just very briefly, the practical value of surveillance in wildlife. I think there are many different applications that we've seen. Please don't be shy about sharing case studies about how surveillance has contributed to your own work and really identifying threats, hopefully proactively, but sometimes, when you're already seeing a lot of impacts. I think this is quite important that we have this body of knowledge, and then we can really advocate, to make sure that there are the resources necessary for surveillance in wildlife. But just to give a few examples, we have seen that there are many applications for conservation, the international spread and impact of chytrid fungus and in amphibian populations, in frogs and salamanders, has been really severe, as we know, and has led to many different declines in species, amphibian species, even some extinctions. So, the importance of surveillance systems to be monitoring and really documenting these impacts and then guiding action. Another example is white nose syndrome in North America. This was introduced and unfortunately is really threatening food production. There's really a risk from the loss of ecosystem services. There's an economic impact of that in addition to the biodiversity impacts. And this is really important then for collaboration among different stakeholders, even a role for those involved in cave management, but also in recreational activities, and really making sure that there are coordinated strategies across states to really mitigate the impact of this disease. Another example, there were unfortunately cases of Marburg virus in Uganda in a bat cave. Surveillance was really crucial to identify the source of that exposure and then guide mitigation measures. And I think that there are some really good examples of the use of that surveillance, and specifically in this case, in the Python Cave in Queen Elizabeth National Park, public health authorities and the wildlife authorities worked together to find a great solution that was really biodiversity positive, public health positive, and also economically viable, and still maintained important tourism activities through the installation of a safe viewing area. So knowing the source of exposure, is there a pathogen circulating, can really allow us then to reduce the risk and work together through a One Health approach. And then lastly, if we think about ecosystem function impacts, the impacts of diclofenac poisoning in gyps vultures in Southeast Asia, really severe declines, and those on the front lines were the first to detect it. Really, those who were conducting annual monitoring and noticed a decline in the nesting, the nesting pairs of vultures, and really said, something doesn't seem right. And then having a system in place to be able to do the diagnostics, to really do the chemical analyses to identify the source. There are a lot of different components that go into that, and you don't want to be figuring out all the pieces in an emergency. Really thinking about what's needed ahead of time, making sure a system is in place can really be vital to detect early and mitigate the threat. So before I hand it over to Dr. Grillo, I just want to quickly go into the key steps for the design of surveillance programs. So firstly, we want to look at the goal of surveillance. So whether it's to identify new pathogens and other hazards, whether it's to confirm the presence of disease or pathogens or toxins, or also the absence, so detection, to monitor or describe a disease, a pathogen or toxin, and how it's changing over time and space. So really thinking about, the spread, for example, monitoring a spread, just to see if there is continued impact or spread. We really need to be thinking about the context, so the resources, are there laboratories in place that can do pathogen surveillance? Are there laboratories in place that can do pathology? Are there laboratories in place that can do toxin and toxicant surveillance and diagnostics and analytics? So really thinking about the resources in place as well as the logistic constraints. We know that there are many logistic constraints, especially when we think about really remote settings that are the places that we of course see many free-ranging wildlife populations, and that makes it more challenging than domestic animal health surveillance in some cases. So we really have to be aware of the practical limitations and be a bit creative in some cases. And then decide on the optimal surveillance strategy. Could be sentinel surveillance, could be active or passive, participatory, for example, involving communities, involving hunters, involving many different stakeholders that may be on the front lines. Rangers certainly are an excellent resource that need to be involved. And then really deciding on the targeted species, the time scale, and then the geographic scope. Maybe it's one protected area, maybe it's all protected areas in a country, maybe it's communities that are closely bordering protected areas. And then designing the sampling protocols and standard operating procedures, including the capacity training needs. So there are many different components here to consider. There's more information on this in the guidelines. But then lastly, step 8, we want to be thinking about results reporting, taking actions based on risk. So again, the use of surveillance findings. And then I think what's most important to reinforce is that we have to always be refining protocols. We're continually learning. The situation is sometimes changing in terms of resources available. So we need to be a little bit dynamic and make sure that we're evaluating our surveillance system and adapting it as needed. So I'll turn it over to Dr. Grillo, and thank you, Dr. Grillo.
Thank you, Dr. Malacheva. It's a pleasure to be presenting with Catherine today and having developed these guidelines with the team. It's really exciting. So to follow on from Catherine's introduction and first setting the scene, just to work through a few other elements that are in the guidelines. So for example, in addition to some of the other infographics that are in the guidelines, there's one specifically that we've put in relation to investigation of morbidity or mortality events. So this is really about sick and dead wildlife, or as in the guidelines refers to as general surveillance or passive surveillance. So we walk through, I guess it's just a sort of note here, part of the guidelines, it's supposed to be accessible to a broad range and broad audience. So we do try and ensure that the language within the guidelines is as simple as possible to be accessible to a broad range of audiences. So this diagram really walks you through what might be happening in general or passive surveillance. And this is normally where someone's detecting a sick or dead animal. And that could be through a range of different people who are in contact with wildlife, be it rangers or rights holders or ecologists that are out doing field surveys for some other purpose. The other aspect of this diagram sort of highlights is that next step that happens after someone sees a sick or dead animal. And that's about making sure that they know how to report. So there might be some element of your surveillance program in relation to a general surveillance program that might require raising awareness, ensuring that people are aware of what to look out for and how to report and what might happen when they report. And that will engage your audience. And there are different messages and different ways of doing that, but that will be an important part of any surveillance program. Once a sick or dead animal is identified, then there's a whole range of aspects that might be considered. And I'm not going to walk through every detail of this diagram, but it walks you through all the different aspects that need to be considered. So for dead wildlife, Catherine's already highlighted that there might be challenges in terms of the location and where the animal is found. Is it actually safe for somebody to go and identify and look at that animal or take a sample from it? It might not be in a good quality. It might not actually be, it might have been there for days and not actually a good quality for an investigation to determine whether or not there was a disease that might have affected that animal to cause it to die. If there's a sick animal, then there might be other constraints or considerations. So how do you catch that animal? How might you take a sample? Have you got the relevant experts in a team that might be able to help you to do that if you're not the expert? And what might be the permits in place that might be required to do that? And then, of course, you're going to be thinking about what samples do you take. So there's a suite of types of diagnostic tests and procedures that are available, and this diagram sort of outlines all of those. So depending on what you think might be happening, normally what occurs first, the guidelines sort of talk through in these diagrams what might happen first. So you might be doing a post-mortem examination, and you might be looking grossly to determine if there's something interesting or unusual within the animal that's maybe undertaken by a veterinary scientist or someone with the expertise who's done that before, and then collecting samples and going through a range of tests. You might not have access to all of these tests. You might be relying on your network of experts or laboratories. So in some cases, you might be relying on a public health laboratory who can do a certain type of test for a certain type of disease or toxin, or you might be looking to an environmental toxicology lab. So sometimes this suite of investigation tools that you have might actually mean that you need a team of people to work together, and it's all about collaboration. So this is just it's sort of outlined this in the guidelines, and there are lots of different things that you can look at. But it doesn't seem, don't let this list make you be scared about doing surveillance, because sometimes you can do a stepwise approach to actually find out what's happening with that animal and still get results. So you don't necessarily need a huge budget to do this in the first instance. So we'll move to the next slide, Catherine. So also in the guidelines, to help you determine what sort of level of testing you might need or types of tools that you might have, there are a number of tables in the document that can help you explore what you can and can't do, or what might be challenging. So one of the tables is about your detection aim. So how might you go about detecting sick or dead animal? And that might be through proactive visual patrols, for example, sending out people on a regular basis to a protected conservation area or a wetland to look for sick or dead birds, for example, if you're worried about avian influenza. Or you might have camera traps up in place where you're looking for visual signs of disease like mange in a wombat, like we would do here in Australia. So the tables walk you through what the types of detection aims might be, what the potential methods could be, and then what are the considerations that you might need to take into account to try and help direct you and support you in your surveillance plan objectives. The other table that is available in one of the annexes is about test result interpretation. And this can also help guide your surveillance plan in determining whether or not you will be able to detect a particular pathogen or to detect that it's been present, but not actually there at this point in time. And so tests are going to be different in how you interpret them, whether or not there's a positive test or a negative test. And these can make things very complicated in terms of surveillance and what the results are, but understanding these considerations in advance of undertaking your surveillance program will help you to design a really appropriate surveillance program and understand what the results mean, and therefore to impact on your actions appropriately, and also your communication of results. Next slide. So when should you be alarmed? So talking about things when you are wanting to work with different community members or sectors in relation to raising the alarm, or what should be on your radar to look for. Many of the following situations that we've outlined are sort of the key things that you can help to drive people to report a sick or dead animal. And some of these relate to things that might be really urgent disease events or potentially zoonotic diseases. So the first one is pretty obvious, but I just wanted to walk through something unusual or different. Is really about engaging. This really highlights the need to engage the people who are in those wildlife environments on a regular basis. They're the ones who understand the wildlife, live with the wildlife. They know what's unusual. So that might be people who are ecologists in that area. They might be the rights holders of that land. They live there, they work there, they're part of their culture or spiritual mandates. Or they might be doing caring for them, and they might be taking animals in on a regular basis as a wildlife rehabilitator, and they know what's unusual when something's really unusual, not, you know, the normal potential hit by car wildlife. There's a large number of birds this month than last month. That's an indicator something might be unusual. So really tapping into the people who have that knowledge is going to be really critical for your general surveillance or passive surveillance systems. They'll also know what's unusual behavior or a neurological sign, which can be a really key indicator for an unusual disease. For example, a lot of viral diseases can result in neurological signs and might be an indicator of an emerging disease, but they might also be an indicator of a disease that we know exists and can be identified quickly and provide information into that, that disease occurrence within that area. And the last one, which I won't harbor on, but unclotted blood coming from different orifices. So this is another one of those classic signs that can be an indicator of something really concerning in relation to a disease, and should be on your list of things to let people know if they see this, you know, blood coming from an animal and it's not clotting. It's definitely time to pick up the phone and alert the relevant authority within the area for where the report might be occurring. Next slide. So just to, I guess, with all of these considerations and the highlight that some of these might be indicators for zoonotic disease, it really is a good reminder to say, and it's reiterated throughout the guidelines, is that you really need to be an authorized person who is trained or has an understanding of biosecurity and how to protect yourself. Protection of yourself from diseases or pathogens or the toxins that might be in the animals that you're dealing with or the samples that you're handling. So it's really important that training is undertaken and understanding of biosecurity is in place for those people doing that in contact process. It's also important from a point of view of making sure that the pathogen, toxin, or isn't transferred to some other animal in the setting or to another animal in another setting. So by undertaking, making sure you're trained and understanding biosecurity, you're not only protecting yourself, you're protecting other animals and other people. You also need to be aware that depending on what type of sampling you're doing, there might be legal requirements in relation to animal welfare, how you handle the animal, how you take the sample. So those are all considerations that are outlined within the guidelines to ensure that you don't forget to think about all the different things, all the moving parts of a surveillance program. So hopefully it's not overwhelming, but it's really important to make sure that you are considering biosafety and animal welfare in relation to sampling of animals. Next slide. So what are some of the other considerations? Well, we've talked about safety and biosafety in relation to collection of samples, both from a sick or dead wildlife, but also when you're sampling apparently healthy animals, you also need to be conscious that there might be pathogens that they're carrying that might be dangerous to yourself or others. And the challenge with pathogens, we can't see them. So you need to always be precautionary and make sure you have your biosecurity considerations like gloves or masks and washing your hands appropriately. There are also a range of ethical and legal considerations. There might be permits that might be required in relation to entering a particular landscape and taking samples or moving samples or bodies of animals. And so at this point, I wanted to sort of reiterate that if you're working on lands where there are, that might be looked after and they're custodians, so if they're Indigenous peoples who are the rights holders or custodians of the lands on which you're working, there might be specific ethical and permit requirements in order to undertake the surveillance in those locations, and that'd be really important. In an ideal world, you should really be co-developing and co-managing your surveillance program with those people whose lands you're on, because those are the animals that are part of their culture, part of their spiritual being, and also they might depend on those species for so many different reasons. So the guidelines do reiterate the need to engage and co-develop surveillance programs with Indigenous peoples where you're undertaking activities on key parcels of land. The other thing that you really need to think about is how the surveillance you want to do fits into the surveillance within the country or within the local context, and not work in isolation. In an ideal world, we all talk together and your surveillance program might actually fit into somebody else's surveillance program and complement it. So it's a real opportunity to be complementary, work together and ensure that you're actively contributing to a countrywide wildlife health objective and One Health objective. And that can help with outcomes for conservation, public health, as well as the economy. The guidelines also outline a whole range of additional resources that might be helpful. And I believe on the next slide, we have an outline of some of those. So the first is to point out that the World Organization for Animal Health has a national focal point for wildlife in all the member countries, and they might be a source of assistance in relation to a surveillance program or know of something already in place. WOAH has also developed some e-learning modules in relation to wildlife surveillance that complement the guidelines, and those will be available for further learning to walk you through the different types of surveillance and really get embedded into an understanding about wildlife surveillance. If you want to dive deeper into surveillance objectives and calculating sample size and understanding how to do an outbreak investigation, there are a range of WOAH training manuals that are available on the WOAH website under the wildlife health topic. And these training manuals have been developed for the focal points for wildlife within each of the member countries, but are very accessible to a wider audience. And they really walk through a range of topics, including how to do a risk assessment, how to do an outbreak investigation, or how to form a network that might help inform your surveillance program within your country. And then lastly, just wanted to note that WOAH are developing these regular wildlife situation reports in relation to wildlife health and disease events that are happening globally. And one of the nice linkages between WOAH and the IUCN is that those situation reports include and highlight the red-listed species that might be impacted by some of those diseases. So at the minute, high-path avian influenza is a topic of concern, and they have highlighted within their high-path avian influenza section the red list species that are being impacted by that. So with that, the next slide. Just wanted to thank as well all the reviewers that we had, again, from across multiple sectors. They were a wealth of experience and really enabled the guidelines to be accessible to a wide range and audience. So thank you also to the collaboration with between IUCN and WOAH. It's been a fabulous collaboration, and of course the Alliance for their support.
Great. Thank you, Tiggy and Catherine. It was an excellent overview. As all of you can see, it's I wouldn't say it's a complicated subject, but it's complex. And that's why we are continuing to recommend, and I think you saw in some of the questions, or apparent in the questions, about this need for working across disciplines and across authorities, because as I mentioned in the beginning, none of us can do this by ourselves. So this is our question and answer period. We're going to probably have to keep it a little short because we're running out of time. Some of the answers are already being posted in the chat individually to you. For some of you that are just joining us now, I just want to remind you that this has all been recorded, so you can watch it later. And then maybe we could stay on a little later just in the chat box so people can see some of the final answers. We can keep running even though we won't be on the screen, but we could just continue with a few chats there to answer questions. But you could see from some of the questions about what's the most common zoonotic disease or some of that. So we highly recommend that you collaborate with others in your local area, or might have species expertise or geographic expertise or disease expertise. So where I live in the United States, I don't know much about what's going on in the western part of the country. So if I wanted to know what the most common disease was there, I might call a colleague or find an authority that's in that state to provide that information. So we're really encouraging you to reach out to people in your countries or in your region, or to some specialists that might know about your region to answer some of those questions. And again, I just really want to highlight some of the questions kind of relate to doing this or that. But as you saw in the guidelines, one of these really important aspects is identifying why you want to do the surveillance before you start doing surveillance, and making sure you have the people that are actually able to do it and are properly trained to do it. We're not encouraging everybody in the world to go around and chase animals and catch them and take a sample without thinking through what the risks are to the animals, what the risks are to the people, and how the information will actually be used. Surveillance, by definition, is collecting information that will actually be used for a purpose and will guide policy and changes. So if it's just interesting, I put that in the research category. When we talk about surveillance, it's about really something practical and useful. So you want to work with your wildlife managers, you want to work with your local communities, we call them rights holders, could be private land, it could be public land, but you just figure out what it is you're trying to do. With that, I think there are a couple of questions, maybe a minute. Let's do a minute. I mean, some are very specific from our colleague in South Kivu from the DRC, asking about what to do with the buffer zone or outside with not a buffer zone. I don't know, Catherine, you want to say a few words about that? I think some of these other questions are being answered in the chat as we speak. So look there about training. Somebody asked about courses to take. There is online. My personal opinion is now, as the guidelines have been finished, if any of you are faculty or professors or teach, I think the guidelines themselves would be a nice exercise for your students to use, and you can run them through, read the guidelines, and do some mock-up, some kind of mock situations where they might design a program and present back to you. So it actually could be used in itself as course or training materials. Catherine, Tiggy, any other thoughts there?
Tiggy, please go ahead.
Thank you, Billy. No, it's brilliant. I think you answered a lot of comments and questions already. There are a few specific ones. I know some of the team have posted the link to the training manuals as well as the training modules in the platform. Some of the other questions in relation to disease risk analysis and brucellosis, there are links within the guidelines to other guidelines that are specific for conducting wildlife disease risk analysis and other tools. There's also some learning opportunities that you could tap into that are directed to within the guidelines. And then I think you really summarized it really well, Billy. So Catherine, did you have any answers to some of the questions?
I'll just briefly say for the question about buffer zone, yeah, excellent point. I think it really comes down to the context, and each protected and conserved area, looks a little bit different in terms of the setup and also the stakeholders. I would say in that case, it's very important to have, a really consistent flow of information. I think our colleagues from Liberia are on, and I know that, there's a lot of existing trust and communication that's happening, and sort of sometimes it's just making the village chief or the eco guards aware of, please be on the lookout for unusual events in wildlife, please be careful if you see these, but please report them, in the appropriate manner, whether it's by phone, whether it's in person, or whatever sort of the most efficient way to get communication in place to where it needs to go. But it will look a little different in terms of the context. I just want to also mention that there was a point from, I think, Natalia, about capacity strengthening and the role of academia. One challenge we've seen, and I know it came up in a few of the excellent chat comments about laboratory capacity, that's a real challenge, resource-wise, sometimes also just distance-wise, about getting specimens to a lab with the cold chain and sample integrity. I would say for toxic agents, it's maybe even more challenging in some cases, just in terms of the networks in place, the cost. So, having those agreements in place ahead of time before an emergency, we know that's important for human health. It's also very important for wildlife health. So I would say if you are from academia, please try to connect with your national wildlife focal point, get those channels in place ahead of time. And I think that's really in line with the One Health approach. Thanks.
Great, thank you, Catherine. So we really have ended, we're at the end of our hour, but I still would like to give Francois and Kevin a little chance for some closing statements. If we really run out of time and I don't get back on, I just want to thank all of you for a great job, but also, as Tiggy mentioned, all the contributors to the guidelines, but then many of you also help with reviewing, because you live out there in the real world and you have authority, management authority, or you're doing conservation work. So we had a lot of people contribute their time to review, and there were several drafts that went out widely for review to make sure they're actually easy to understand and useful. I want to thank the funders for this project that came through kindly from the German government and went through GIZ and the Alliance for Global Alliance on Wildlife Trade. So that was great. And then the in-kind contributions from WOAH and IUCN for really getting this all organized, and doing the layouts and the printing. And there's been a lot of time invested from both organizations there too. So I'll say thanks, and I will not come back, but I'm going to turn it over to you, Francois, and then Kevin. So thank you all.
Thank you, Billy. So I'm going to conclude from my part this webinar. So thank you once again to Dr. Mashalaba and Dr. Grillo for your presentation. It was very clear. And I would like to inform all the participants that we will share soon the guidelines with all of you by email. And accompanying these guidelines, we will also send you a short questionnaire to get your feedback on the guidelines. And in particular to know if you are going to use them and how you are going to use them, and also to provide us with some idea for future IUCN WOAH collaboration. So thank you in advance. And so now, Kevin, is for you.
Thank you, Francois. And yeah, this is great. I was a little bit concerned at one stage that we weren't going to get any questions, but I think I don't think I have that fear anymore. So as Billy mentioned, I think there's loads of the team from WOAH and IUCN are on there trying to answer as many as you can. We will stay on even once after we finish just to try and answer as many as we can. So IUCN and WOAH are signing an MOU. We're really trying to work closely together in support of the WOAH's Wildlife Health Framework, and also with the work that IUCN is committed to do on One Health. And we'd love to hear from you. We have people here on this call who are IUCN Commission experts, who are members of IUCN. We have people a part of the WOAH membership and focal points. We'd really like to hear from you about any potential ideas that you've got for collaboration between IUCN and WOAH. I mean, I think a lot of people on the call, this is where the boots hit the ground. This is where a lot of the action is actually happening. So as Francois mentioned, we will be sending an email round with a link to the guidelines with a very short questionnaire. We'd really value your inputs on this to help us work out where we're going to go next. You might have ideas on additional guidance, capacity building activities, and anything that you think is really useful to tying in the WOAH and the wildlife conservation sectors together. And I think that's it from me. And Billy, I don't think you want the floor back. I would just like to thank everybody again for their time on the for joining us. I hope you found it useful and interesting. I definitely did. I'm always learning on this subject. I think it's absolutely fascinating and so important. So thank you very much. I'd thank WOAH, Wildlife Health Specialist Group, everybody who's been involved, the donors. So thank you. I will say goodbye. If any of the other team want to say anything, then please do. Thank you for joining us. Sorry for overrunning slightly, but I hope it was worth it. Take care, everybody. Bye-bye.
Bye.